Alright, now we're going to move on to the behavior therapies section of this video. What are behavior therapies? Behavior therapies are therapeutic solutions that place an emphasis on more active strategies when working to instill change within a person's behavior or behaviors. They utilize learning in order to diminish or completely remove symptoms or poor behaviors that a person may exhibit. Behavior therapies demonstrate a departure from the psychodynamic and humanistic approaches to therapy, which are more focused on cultivating the awareness of why people have specific symptoms. Behavior therapies originally started with simple, classical, and operant conditioning strategies, but over time have branched out to include other methods, such as observational learning, cognitive factors, and self-instruction. Classical conditioning systematic desensitization. The first classical conditioning-based behavior therapy we are going to look at is systematic desensitization. Systematic desensitization is a behavior therapy that involves putting a person through a real or imagined situation that is supposed to evoke fear within them. This method is based on the idea of extinction, specifically extinguishing the fear response to certain fearful stimuli. It aims to get the client to remain relaxed when put in increasingly feared situations. This could be with things such as in the picture showing arachnophobia, or like the fear of spiders, starting out with small spiders and working up to bigger ones. And they may start with like a fake plastic spider and then move on to real spiders. Systematic desensitization has been proven to be an effective method for treating anxiety disorders as well as various phobias. To my point about the arachnophobia. Studies have also shown that when paired with music, systematic desensitization can be an effective technique in combating craving in drug users. I thought that was an interesting thing to point out. Next, we have the next classical conditioning-based therapy. The next classical conditioning-based behavior therapy we are going to talk about is aversive conditioning. Aversive conditioning, is a behavior therapy that is designed to eliminate problematic behaviors by decreasing the positive associations of an unconditioned stimuli. Specifically, this therapy solution pairs an unconditioned stimuli, such as alcohol, nicotine, or some other addictive substance, with a conditioned stimuli that would evoke a sense of aversion within the client. This conditioned stimuli could be anything, such as painful electric shocks, substances that induce nausea, or hurtful insults. Aversive conditioning has proven itself as an effective strategy for teaching people to avoid certain actions, such as addictive behaviors. So, like alcoholism or smoking addictions. As previously mentioned, aversive conditioning is typically used to counter addictions. Moving forward, we have our operant conditioning-based therapy. The operant conditioning-based behavior therapy that we will cover in this presentation is applied behavior analysis. Applied behavior analysis is a behavior therapy that aims to replace maladaptive behaviors with other, more positive and beneficial ones. This therapy technique is commonly used to treat those with autism spectrum disorder, or ASD, who may exhibit problematic behaviors, such as actions that can injure themselves. An example of this could be headbanging. When practiced early and for a prolonged amount of time, applied behavior analysis can improve the cognitive and language capabilities of young children with autism spectrum disorder. Now, this treatment type is extremely intensive, and because of this, has become controversial as it can create trauma for those who are forced to undergo the training. Just something to keep in mind. I think it's very sad that that people are coming away with this with a negative kind of experience, but it's understanding, and going forward, if we continue to use applied behavior analysis, we should look to do it in a more thoughtful way so that we're not traumatizing individuals or hurting them in some capacity. Finally, we have the effects of behavior therapy on ADHD. Behavior therapies can have a positive effect on ADHD symptoms. New studies are finding that behavior therapies, such as those developed for people with tics, are having significant effects on the reduction of ADHD symptoms over the course of many weeks. Now, this can be seen in this graph right here, specifically in the Vanderbilt ADHD severity graph right here. Over the course of 24 weeks, they used different behavior therapies to treat different disorders. So this included things like co-occurring ADHD, tic disorders, and psychosocial impairment. Now, if you look at this bottom left graph here, we see that the CBIT method, which is the dotted line, that is our kind of cognitive, I believe they refer to it as the comprehensive behavioral intervention. So that's one of our behavior therapy strategies. And as we see, there's a severe dip at around the 12-week mark in ADHD symptoms. So this does prove that over time, the use of behavior therapy can decrease the symptoms and severity of symptoms of ADHD. Now, this positive effect has started to point psychologists in a new direction in regards to developing new non-medical treatments for those with ADHD. A focus on behavior therapies could create a new route for ADHD treatments in the future. Now, as I mentioned with this graph, we see that it does start to rise over, I guess, the end of the study towards the 24-week mark. Now, this does raise the kind of idea in psychologists' mind that prolonged use of behavior therapies could, and sustained use, could help with reducing over a long period, over the long term, could help in reducing ADHD symptoms and their severity. So, yeah, thank you. That's my presentation, and I hope you have a great day.